Going up and down the stairs after a knee replacement surgery can be really scary. Stairs are steep. You could possibly fall. You don't have a lot of strength in your leg after surgery. Your knee is swollen. It doesn't bend well. It might be painful to go up and down the stairs. So there's a lot going on with the stairs. So in this video, we're going to go over how to safely do the stairs, and then I'll give you some exercise ideas to master going up and down the stairs, because if you are beyond that 3-month post-surgery mark, you probably are having pain with going up and down the stairs. So I'll explain that in today's video as well. For those of you who don't know me, my name is Dr. Samantha Smith. I'm a physical therapist that specializes in knee replacement. So I have my YouTube here specialized with knee replacement recovery tips, my TikTok, my Instagram. Please follow me. I have a lot of really fun videos for you guys to watch. And I also teach educational courses and exercise classes for those of you preparing for your knee replacement or recovering from your knee replacement. So you'll go to succeedcourses.com to view all of that information. So let's get into how to do the stairs right after your surgery. So if you are fresh out of surgery, you may need to go up a step or a couple steps to get into your home. You should be able to do those things before you leave the hospital or the surgery center. They should be practicing those steps with you before you go home. The last thing we want you to do is go home and not know how to do the stairs and then you possibly fall. So you definitely need to practice the stairs before you leave the hospital. When you get home to do the stairs, you want to follow the rule: up with the good, down with the bad. So the good goes to heaven, the bad goes to hell. That's how you remember it. It clicks in your head. It's easy to remember. So your good leg is your non-surgical leg. Your bad leg is your one that you just had surgery on. So that makes sense. So when you come to the stairs, if you're able to have the railing on your knee replacement side, this railing is nice and sturdy. It's not going anywhere. So if you are going up the stairs, so let's say this is my knee replacement knee over here. I'm gonna go up with my good leg. My good leg is gonna push me up. This leg over here is just along for the ride. I'm gonna place it right on the other step. Let me demonstrate up here so you can see. My other leg, this is my knee replacement knee. It's just along for the ride. It's not really doing much. I'm gonna put my other leg up with the good, and right back up. And when you go down the stairs, you're gonna go down with your bad leg. Now that might sound scary. So let's say this is my bad leg right here. It's going down. It's not doing anything. This leg over here is doing all the work. So we're going down, place that leg right on the step, and then hurry up and get that other foot down, because this leg, your knee replacement knee, does not like to do much. So down with the bad. That makes sense? You go down with the bad. Usually people figure that out really quickly. If you go up and down the opposite way of what I described and just demonstrated, your knee will not like that. So you will notice pretty quickly that that doesn't feel good, and you'll go up and down the stairs the other way pretty naturally. It comes pretty naturally. But right at first, those stairs are a little bit scary. So having that up with the good, down with the bad in your brain really helps. I even have people kind of write it on a sticky note, place it on their the railing of their stairs so they remember. That way they don't get mixed up. That helps sometimes. So that's a great way to do it. If that is not possible, if you don't have the range of motion, or you maybe just don't have the strength of the other leg to go up and down like that, you can also go up and down sideways. So you'll want to hold on to the railing. So you're here holding on to the railing, my hands are on the railing, and you're just going to go up and down just like this. So that is another great way to do the stairs with a safe way to go up and down the stairs is to go sideways. You just have to be careful with where you place your feet on the stairs. Make sure both feet go on the stairs when you go up and down sideways. Another really great way to do it. You can also, if you have the ability to get on and off the floor, you can go up and down on your bottom. Not the most ideal way because you have to get on and off the floor, but for some of you that may be super easy. So you just kind of go up on your bottom, use your good leg to push yourself up. Here your hands are on the stairs, use your good leg, push yourself up, and you can go up and down the stairs this way. That is a really great way to do it. That's how I teach people who have non-weight bearing restrictions and they're not allowed to put any weight on their possibly broken leg. I teach them to go up and down the stairs on their bottom. That is for a special person who's able to get on and off the floor, properly and has the strength to do it. So please don't try that if you can't get on and off the floor. So those are the ways to do the stairs in the first, couple weeks, month after your surgery. After that, you do want to be able to go up and down the stairs without even having to think about it. You don't want to have to think about that up with the good, down with the bad kind of mantra in your head when you go up and down the stairs. You want to be able to go up with whatever leg you want to go up with. So that's exactly what I teach my patients. Hey, let's start practicing going up with the bad leg and down with the good leg. So there's a specific way to practice that, and it's super easy. So all you do is you come to the bottom step of your staircase, hold on to the staircase, practice going up with the bad leg, come right up, and then come right back down. And we're practicing up and then right back down. And you'll do this 20 times is usually what I recommend until you master that. Then you can safely go up and down the stairs if you can do one step at a time. Makes it a little bit easier to do the full staircase. So if that doesn't feel good, you will want to find a smaller step on your property that you are able to go up and down with, or you can get a stair trainer. So you can get these on Amazon. They are stair trainers and you can build them up. They come with legs on them and you can make them higher and higher until you get to a standard step height, which I believe is about 8 to 10 inches. So you'll want to start at a lower height, maybe like 2 to 4 inches. Practice going up and down that step 20 times. Once you master that, build up your stair trainer. Go to 4 inches, go to 6 inches, go up and down 20 times. That is how you kind of master the stairs so you can comfortably go up your staircase. With going down the stairs, it's a little bit different. Going down the stairs is trickier than going up for most people. Sometimes it's the complete opposite. People struggle going up the stairs more so than down the stairs. But to go down the stairs, the reason why it is so challenging to go down with the good leg, so this would be my good leg. My bad leg over here is doing all the work. That is so much pressure on this leg here. And look at my kneecap. My kneecap goes in front of my toe. That is so much force onto the kneecap. That really, really doesn't feel good. So when you go here, that kneecap is way in front of the knee. That does not feel good. So that's another thing you have to practice. You have to practice training the knee to do that knee over toe position here. I have a full YouTube video on this, how to go through a proper sequence to train that knee over toe type of movement so you can get used to it so you can go down the stairs with less pain. A question people ask me all the time is, when will I be able to do the stairs comfortably? I have heard anywhere between 3 months and 2 years. The spectrum is so wide because it depends on your body, your strength, your mobility, your previous, level of activity, what you're doing. Are you severely swollen? Do you have diabetes? Do you have heart problems? All of that is taken into consideration when you heal from a really big surgery. So that is why the spectrum is so big. You might see somebody who has really awesome strength. They were doing a ton before their knee replacement. They can go up and down the stairs with very minimal pain, within a couple months, versus somebody who might be in their 80s or 90s and going up and down the stairs was challenging for them even before their surgery. It might take them a lot longer. So typically I would say between 6 and 9 months, people can go up and down the stairs pretty comfortably. You can go up and down the stairs, within the first month after surgery, but it might be painful. But we're talking about when that pain starts to diminish. When does that happen? I would say the average is between 6 and 9 months. But if you go past that 9-month mark, there's nothing wrong with you. It just takes time to kind of get the body to calm down, so you're able to do those type of movements. But the best thing you can do is strengthen that quad, which I show you in that other YouTube video. Please check it out. Hope this video was helpful and insightful. Please subscribe. Follow me on social media for all my other tips and tricks. Thank you guys so much for watching. I'll see you again next time.